Hi, in addition to the first aid kit that is going to be in each one of the rooms, you'll also have an emergency trauma kit. And in that emergency trauma kit is various instruments that you might be using at a time when there was in a lockdown drill. I mean, in a real lockdown situation. This is not a training for this is not training for those things, but we're trying to get everybody trained throughout the year, and it will start on September 22nd. Will be our first optional training here at O'Connell on a Saturday morning with the Arlington EMS. Some things that you need. I'm just going to go over what's in the bag. First, there is a trauma dressing. This is called, and the trauma dressing is specifically used to cover a person. It's a gauze blanket that's used to cover a person who's been wounded, or it can be used to provide privacy between two students. Could hold it up and provide privacy in the classroom. Also in the bag, you'll see a rescue blanket. This is a foil blanket, and this would be, someone in shock. You could put this blanket over a person to keep them warm. Also, there'll be rubber gloves, to protect you from bloodborne pathogens. These should be put on before using any of the other items in the basket. There's some Smarties in there as well, in case there's someone with diabetes. You can give them some sugar. Someone who's going through a diabetic shock, or blood glucose is dropping. We also have this. This is just a gauze bandage. If someone had been hurt in with a gunshot wound, say, this you would wrap around. You would stuff into the wound to make it stop. After you put the tourniquet on, which I'll talk about in a second, the gauze bandage you would use there. Again, I'm just going over these things. There's specific training that will be available. We just want to make sure that everyone knows what's in the classroom. This here is a chest seal, and this would be someone who's been wounded in the chest, is having trouble breathing. There's directions on these right on the back here, but it's a plastic. It's a sticky piece of plastic that you would put over the wound on someone's chest. And finally, there's the tourniquet, and the tourniquet is used to stop bleeding from one of the limbs. You can either, to put it on, it just goes on over like that, it tightens up, and and then you twist, it twists, and it should twist until the bleeding stops. And then when you finish twisting, you put it in like that, and that would be the tourniquet that's there as well. So these are just some of the things that are in the bag. We just wanted to make sure you're aware of those things. And like we said, training starts on September 22nd, and that should give you the opportunity and there'll be training throughout the year, optional training for all teachers. Thank you.